So the first few days after I brought my baby home, I was pretty sure that we were just dealing with getting to know each other and just that initial milk coming in process that is actually relatively normal for most moms that are breastfeeding. But as the days wore on, I was experiencing such severe pain that I was getting up most mornings just in tears with just excruciating engorged breasts, to the point that I didn't even want to be touched because it was so painful. And my baby was getting frustrated because she would try and try and try to nurse, but she just wasn't able to latch properly. So we've gone through days of no sleep, and I'm frustrated, my baby's frustrated, and we had decided that we really had to do something. So we contacted Dr. Trout's office. They got us in so quickly. We're waiting for our daughter to go back, and we were full of anxiety again, even though we knew that in our mind it was going to be okay. And they brought her back, which kind of freaked us out a little bit because now we're separated, and we were thinking we were going to be here all day hunkered down. So we brought snacks and tablets to entertain us. And we're just getting into panicking mode, and 5 minutes later they come out and they say, "She's done, she did great." And it was like a breath of fresh air. It's like, wow, that wasn't that bad at all. We built it up worse than it actually was. So we went back, and Dr. Trout carefully went over all the exercises that we needed to do, and it really wasn't as bad as we had thought it was going to be. It was kind of sad that we built it up over those couple days worrying about it over nothing. Then we brought her home, and I was kind of militant about the exercises. I had an alarm set for each time I was supposed to do them, and I was thinking initially that it was going to take a lot longer, but once you start doing the exercises, the whole process takes like under a minute to do. And sure, your baby gets really upset while doing it, but that's what breasts are for. So when you're done, you just pop them on and they're completely consoled. And I would say within that day, she was able to nurse properly, and it was so wonderful. And my breasts were emptying, so the pain was gone, and it was just so worth it to have that done. So my recommendation to moms who have heard the word tongue or lip tie from a medical professional or from a lactation consultant is to go in and find somebody like Dr. Trout who is able to perform these procedures and have it done quickly so that you don't have any long-term problems. I've heard of people that have waited and not done the tongue tie when it's recommended, and their kids have speech problems, they have dental issues, because especially with the lip tie, the food gets trapped up in there and they can get dental issues, which it creates more problems over time by not getting it done.